In the meantime, non-state healthcare sector players are calling on government to live up to its obligations and fully fund the primary healthcare and the emergency and critical illness funds under the Social Health Authority to make the program sustainable. The government has been accused of depending only on Kenya's direct contributions to SHIF and failing to allocate resources to the other two funds, making access to healthcare for a majority of Kenyans difficult. Brenda Wanga reports.
5 months into the rollout of Taifa Care, the government's ambitious universal healthcare program, and non-state actors are calling for an urgent review of the program in a bid to steady the ship that they say is sinking due to financing constraints.
The current SHA model is unsustainable. And I'm going beside the politics. I just want to, because we were involved in the financing discussions. I remember we started from 700 billion, 465 billion, went down all the way to 275 billion. You know, these were projections based on how much money we need to finance healthcare, and we were having these discussions in a room like this.
What we've seen so far is that things are not working the way they were intended to work. And our members are on the ground in communities providing services, and they can see what's happening. Citizens aren't able to get the services. So definitely, it's clear that something is not working.
These financing gaps have been evident in the primary health care and the emergency and chronic and critical illnesses funds. At the rollout of Taifa Care, the government allocated 6.1 billion shillings against the required 50 billion to the primary health care fund and 4.1 billion shillings against the needed 75 billion for the emergency and chronic illness fund.
Primary health care in the country is currently underfunded completely. And we would urge that our parliament really allocates money to support primary health care.
This is where the problems are coming. If you ask yourself, these funds, why is it that they don't have money? They are the only two funds that are funded by the state. The SHIF fund, which is the one which is being touted as working, is funded by you and I. We are the ones contributing either 2.75% or through, proxy means testing. So the Kenyan people are doing their part. They are doing their part to make sure that the Social Health Insurance Fund is funded. Our appeal to government is that you also do your part.
We have quorum.
The CS appearing before Senate on Wednesday, while admitting to what government has christened teething problems, maintains that Taifa Care is a step up from the now defunct NHIF.
You observe that the challenges are still present. They talk about human resource for health, and you can see even for us as a country, we are having our nurses and some people going there. So it is a journey, and we have to start somewhere. And our priority was to ensure that all Kenyans are registered. That way they can be able to access services. And so this is a priority to us, registration. Additionally, health financing, ensuring that contributions are coming up.
Her assurances notwithstanding, the faith-based health providers have expressed fears over the prevailing state of affairs in regards to what the government still owes them to the tune of 2.2 billion shillings. The private healthcare provider similarly embroiled in a wrangle with government over unpaid bills.
We have suppliers that we got things from, and we can't pay them using the current money because we also have current suppliers that we need to pay with the current money. And it is for that reason that we are coming out to say that there is a cash distress in faith-based hospitals. It's a big problem. Our leaders are thinking about it. They're having crisis meetings. They're probably going to look for government.
Brenda Wanga, Citizen TV.